So welcome back, doctors. Today the topic is cardiovascular regulatory system, the local as well as systemic. This will cover a lot of competencies and a lot of MCQs as well as long questions, short questions are coming on this topic. So if there is sympathetic stimulation, heart rate will be more, and when heart rate is more, it is called as positive chronotropy. Then beta 1 receptor is also stimulated on AV node. It is also on the AV node. AV node is responsible for dromotropic action. So the conduction will be fast. So there will be also be positive dromotropy. It also supply his Purkinje conductive system, same dromotropy, and also to the atrial and ventricular contractile tissue. So force of contraction will be more, and if force of contraction will be more, it is called as inotropy. So in response to the stimulation of sympathetic nerve, there will be positive chronotropy, there will be dromotropy and inotropy. Am I clear? These three are the properties of the heart. So on the other hand, this was about the sympathetic. Now about the parasympathetic. What is release? Acetylcholine. I have given you example. If you are relaxed, if you want to chill with your friend or girlfriend, whatever, and you want to enjoy the food, acetylcholine will be released from vagus nerve. Vagus nerve is a cholinergic, isn't it, for the nerve, and it activates muscarinic 2 receptor in the heart, notably on SA node and AV node and atrial muscle. So what will happen? AV node, so heart rate will be low. You are relaxed, your heart rate is 60, 64 and you are chilling. And what will happen? What will happen? On the atrial muscle also, so atrial contractility will also be low. So your heart rate will be low and atrial contractility are reduced. So this was about the heart. First we discussed about the blood vessel only. Then we discussed the innervation on the heart. Now I will discuss how your blood pressure is controlled. Cardiovascular regulation of your blood pressure. Okay. So what is BP? You know, the lateral, the pressure exerted by the column of blood laterally is called as BP. Systolic BP, diastolic BP. So BP is very important because if there is an injury, suppose there is a road traffic accident and we lost the blood, it can cause shock. What is shock? Hypoperfusion of the tissue. So you need always to control your BP. See, now you are living in a very sophisticated environment. We are not supposed to. We are in the jungles. And the only problem is that we can lose blood. Some will attack on us and we can lose our blood. So the main mechanism is always to make your BP high. That is why all are having hypertension. Because the main mechanism is always to increase your blood pressure. Okay, only baroreceptors can also decrease. But the main mechanism is to increase because the main damage is what? Main danger is we can lose our blood. If we can lose our blood, it can decrease the BP, then how it is controlled? If it is not controlled, we will get into the shock. What is shock? Hypoperfusion of the tissue. That is why they are immediate method, they are intermediate method, and they are late method. They are very strong method, late method. So immediately, for example, if you are in the supine position and you wake up in the morning, all blood will pool to the leg. So there will be no blood in your brain and we will go like this, syncope will happen, we will fall down. It is called as orthostatic hypotension. So how this immediate BP is regulated? As you are coming from the supine position to the standing position, I am standing for a long time and my blood is pooling. Why I am not falling down? My BP is regulated immediately. Within second it is regulated, and immediate method is baroreceptor, then chemoreceptor, and then CNS ischemic response. So these are the 3 methods of BP regulation. Okay, so I will discuss one by one in a detailed manner. This is very, very important topic. This has to come every year in your examination. Not only examination, this will build the concept of hypertension, antihypertensive medication, in your medicine, the types of all those things. So please be very much aware of each and every word. Can you understand? Can you appreciate the use of this? I am standing and my BP, my blood is falling down. So how it is regulated? This is called as BP regulation.